Let's talk about the MACSlift. A lot of patients come into my office and ask about this procedure, and usually they think it's spelled MAX, like maximum lift. It's actually more like a mini lift, so I should probably rename it, but I'm not the one that named this surgery. A MACSlift is a smaller or lesser version of the full facelift that we've been seeing pictures of. And this is a procedure that I like to do for people who just don't have the downtime for a full lift, or they're too nervous about doing something like what I just showed you there, or it's a financial situation. The MACSlift I can do in the office under a local, so it doesn't cost nearly as much because you don't have to pay for the anesthesiologist and the doctor or the hospital. And so this is kind of an in-between facial rejuvenating procedure, and it's really a great procedure too, and I'll talk about it a little bit here. The incisions are very similar to what I showed you for the other lift, but they don't go behind the ear at all, and they don't extend along the ear line. They just go in this front area as the other one. And it's basically, instead of lifting up that muscle as a continuous sheet, as I showed you, the muscle is lifted with these looped sutures. And so it's called a plication facelift versus a facelift where we lift the whole muscle and excise the excess tissue. So we place the incisions in inconspicuous areas. It's performed under local anesthetic. We give Valium, but I did one yesterday, and I was just chatting with the lady the whole time, and she did one yesterday and one today. And they were just, totally different patients. The one today was a little bit older. I'd kind of recommended a bigger procedure, but she, for several reasons decided to do the MACSlift, and I think she'll have a really excellent outcome. So it is a great procedure, and we have a couple of little video clips here that aren't all that helpful, but they kind of show the skin flap being lifted up there with that retractor. That's how much skin is dissected, so it's a little bit less involved than the one that I showed you with the other video, and it's done with these sutures, which we're showing right there. And then this is putting some sutures in, so just kind of the same thing. So let me show you a couple of examples of this procedure. What this is really good for is jowls. It's a great jowl procedure, and if people come in and they say, "This is my only concern right here, can you fix that?" then that's a good candidate for a MACSlift. If they say, "I hate my heavy neck," I try to talk them out of the MACSlift, because the MACSlift is just not a neck surgery. Now, it will improve the neck, and most people are pretty happy, but I think you just have to understand it's not nearly as involved with the neck rejuvenation as some of these other things. It's a shorter recovery, about 1 week of kind of laying low, and then usually another week of some mild bruising. It's really a much quicker recovery. All the stitches are out by day 10, and that applies to the other facelift as well. It again will look a little bit irregular, pulled and feel tight for a week or so, and then the facelift scars fade really well. So this is an example of a MACSlift, and I saw this lady in my office about 2 years after her surgery, maybe 6 or 8 months ago, and she still looks really good. She's very happy with it, and I didn't think she would get this much neck improvement. You can see she really got some pretty good neck improvement. I do liposuction the neck with the MACSlift, and so it can really help a lot in the neck. If it's much more than this, though, I think you're going to end up with at least some sagging of the neck still. But yeah, she was holding up well a couple of years out. People ask me how long it lasts. I don't really know. And the reason I say I don't know is because everyone really, truly ages differently. And some people 10 years later will look like they did at 1 year, and some people in 2 years will start to have some jowling again or some loose skin. And so you just kind of have to work with each individual patient. Another patient I kind of recommended more of she was a little bit older, but she really just she didn't want to go under anesthesia. That was her big thing, and so we decided to do the MACSlift, and she understood what it could do and was very happy. This is more of the typical patient, a little bit younger, not a lot of neck issues going on, and you can see just how it really improves the jawline is what it really improves a lot. And she looks very natural, doesn't look like she had a facelift, and she was very happy. Does anybody have any questions so far?
So if you felt like a MACSlift was good for you now, can you have the full facelift, say, later?
Yeah, really good question. Every time I do a surgery, I'm always thinking, how is this going to be if I have to do something else in 10 years? And the MACSlift, any surgery, no matter what it is, if you've had a surgery before, it's always a little harder to go in the second time, and because there's always scar tissue. If I didn't do the surgery, then I don't know what the anatomy is. I don't know if the nerves are exposed, and so it's always better if you can, I guess, stick with the same person if you're going to have a second surgery, because at least they know what was done before. But no, it's not a, you know, it doesn't preclude you from doing surgery later on. But you know, it's so funny you asked that, because just today when I was doing this MACSlift, I was thinking, how can I suture this so that if I come back, it doesn't, things are not distorted and they're not out of place, because there are a lot of really important structures in the face that we don't want to mess with when we're doing something like this. And so yeah, it's something that I'm thinking about, and absolutely, if in 10 years somebody decided, okay, I had the Max, I loved it, but I need more now, it's definitely something that can be done.